For many years, South Africans have not had a healthcare system that caters for both rich and poor. With this realization, the government sought to introduce the National Health Insurance Plan.
National Health Insurance is a fund that's going to be administered nationally. Through this fund, we want to ensure universal access to health. Now, by universal access, we mean access to every South African, regardless of status or income. Through the National Health Insurance, we want to ensure that people receive the health care that they need promptly when they need it and without paying any funds out of pocket.
As part of the National Health Insurance, the Department of Health will send teams of community healthcare workers to every household throughout the country. Their aim is to promote health and catch diseases early.
Through ward-based outreach teams, we want to take health services into the community, so that a ward-based outreach team will visit communities in their homes, do health education where it's required, for example, to visit a sick person, give advice about managing specific conditions, give advice about how treatment needs to be taken, and so on.
Dibueng Felang is part of the community healthcare workers team in Wolmaranstad, who take healthcare right to people's doorsteps.
So it based more banning by under 5 years, pregnant women, chronic disease. I mean, I get chronic care, but we get treatment every month more clinically.
Today, community health worker Dibueng and her team leader Sister Mitse have come to assess a 2-year-old girl who has never been to the clinic since birth.
No defaulting. I have immunization in the shop. So, we have a system of immunization in the shop.
Ya ka ntse ke sa mo isige ke ya ka khalele nna ntse ke kula ya no go sena motho ka mo ntsela a mo isa
khate re bontsha gore ngwana ga go le sentle ga go le yalo mmelene re mo fa hele thoko gore mo motogong wa ngwana o tshwantse motogo wa teng ka o tshela bikinyana mashi kgotsa sena mashi ka o tshela rama kgotsa ka o tshela pina bata gore ngwana khone go gola sentle so ya ka a sa go le sentle ke ngwana ra go motlholang kgwedi le kgwedi re ntse re tlisa motogo go fitlhella ngwana gola sentle kana go tla ba setse yanong a le mo waiting e tshwanetseng ra go mo ya mara ga bo 3 months mara ga 6 months but gona nna ra go tla kgwedi le kgwedi gore re bone gore re le ka go thusa mmeyang.
A year ago, 35-year-old Shadrach woke up paralyzed in hospital.
The shock turns after 2 days. Ke bo za ke tla ja bona ke se hospital di sister ke di patient ze ni tse teng ke bo za sister assistant ko esala system tlo eme on a stroke e jwa okay ya dula tsepo ke dutse na ka kana ma 3 months.
When Shadrach was discharged, he had limited use of his arms and legs. He used a wheelchair to move around, but he found it difficult to take care of himself.
Did you see maybe 2 weeks more? After 2 weeks, I think a lot of sister called me, the caregiver. Yeah.
Have fitla nete re mo fumane ntate Shadraka ena a kula sa kgone go tsamaya ne.
Na go ke sa kgone go tlhapisa. Ke nana tlhapisa. Angaba sometimes ankuka re mo ema. Trao ema. Re wa kenya.
Thanks to the care Med Julia was able to give Shadrach in his home, he's now able to walk again and take care of himself. 24-year-old Mikey Ndaubane is HIV positive. When she was pregnant, she was visited at her home by community healthcare workers and advised to go to the clinic to get treatment to prevent the transmission of HIV to her baby. Thanks to the advice of the community healthcare workers, she gave birth to a healthy child. The community healthcare workers continue to do follow-up visits with Maki and her family. They advise her on what to eat and how to stay healthy.
Today there's a follow-up. I expect for about pick up your weight. 3 weeks, maybe it's not 2 kg. I'll go to 2 kg or 3. Mama, regarde. Tu ris. Qui a dit ma carte à wana clinique. On s'arrête ma clinique.
Despite the health workers' enthusiasm, her hopes are soon dashed, as the mother did not take her child to the clinic. A lack of cooperation from parents are one of many challenges the health workers encounter in their day-to-day work. Despite these challenges, Dibueng and her fellow community healthcare workers are dedicated to ensuring that every person in their community is able to have access to healthcare. The future of the National Health Insurance looks set for a brighter tomorrow. Since its implementation, more and more people have had access to much-needed healthcare that they never had before.